was what are the issues with TMJ, and I can address that just a little bit. TMJ is kind of a ubiquitous term. Of course, that means the joint itself. A lot of people, when it becomes disease, you call it TMD, or temporal mandibular disorder, and there are several things that can cause that. Sometimes it can be an arthritic problem. Sometimes it can be an issue with extra bone growth, and my own family has had this. The mandible still has the ability to produce bone longer than some of the other bones do, so the jaw can start to grow, and then there'll be an issue with that. Occlusion sometimes can be a problem if the teeth don't fit together properly, and sometimes you can have defects in the discs, the soft tissue separating the two bones in the skull, and I know I'm missing a number of things, but anyway, those are some of the issues that can occur, and a lot of those thankfully can be treated. Some eventually have to be treated surgically, but the vast majority do not, thankfully. So, anyway.
But you see people with like major headaches and things like that as far as the symptomology associated with it, don't you? Or just kind of lots of things that I wouldn't think are associated with such a local area?
Yeah, that's a good question, and you sure can. The tendons and muscles of mastication all work together, and when they all get to rolling and get fired up, you can have kind of like spasms and stuff like that can go all the way up the side of the head. It can affect other muscle groups as well, and that can lead to headaches, and can be hard to diagnose sometimes. We'll see that occasionally in our endodontic practice. Somebody will come in for a toothache, but it's kind of vague, and you can't tell, which tooth it is. There's no fillings in there, what have you. And then eventually you come down to, well, it may be a TMJ problem. And from an endodontic standpoint, we'd probably treat them very conservatively to start with, maybe muscle relaxants, warm compresses, and then eventually probably get them to their dentist to make a splint, treat them with ibuprofen, non-steroidals like that. And a lot of times the symptoms will go away and also help us with our endodontic diagnosis. But headaches, obviously, that can be attributed to that. There are a number of other things that can cause headaches that sometimes we can get into as dentists. Other times it requires a referral to neurologists and help us out a lot.